AIDS is an ongoing, also called chronic condition. It caused by the human immunodeficiency virus, also called HIV. HIV damages the immune system so that the body is less able to fight infection and disease.
Today we're gonna talk about the Republic Act of 8504, also known as the Philippines AIDS Prevention and Control Act of 1998, and also AIDS or HIV. But before we start our documentary about HIV, let's interview a professional to know the basics of HIV.
We have brought in here a health professional that we're gonna interview about HIV.
Good afternoon, everyone, and doctor.
Hello and good afternoon. My name is Dr. Talakas and I'm a medical doctor. And I've been working for 5 years and today I'm going to share my knowledge about AIDS, also known as HIV. So what is HIV? HIV is a virus that spread through contact with genitals, such as during sex without a condom. This type of infection is called a sexual transmitted infection, also called an STI. HIV also is spread through contact with blood, such as when people share needles or syringe. It is also possible for a person with untreated HIV to spread the virus to a child during pregnancy, childbirth, or breastfeeding.
Do we have a cure for HIV?
Currently, there's such no care for HIV, but medicines can control the infection and keep the disease from getting worse. Antiviral treatments for HIV have reduced AIDS deaths around the world. And there's an ongoing effort to make ways to prevent and treat HIV or AIDS more available in resource-poor countries.
Thank you for sharing us your information about HIV, Dr. Delakas. We are gladly to meet and greet you.
We're gonna talk about AIDS, or also known as HIV. As from the interview before, HIV is a very widespread virus infecting millions of people. Even though our medical technology is way more advanced than before, we still haven't found a cure for HIV. Although we already have treatments, it's not a very long-term effect to stop the virus. We can only prevent it from spreading, like wearing a condom during a sexual intercourse or getting tested for HIV to know if you have it or not. But even with these precautions and safety measurements, there are still many communities that are affected or suffering from this due to lack of education, poverty, rape, and even more. We interviewed one of the victims of HIV. For confidentiality purposes, we're not allowed to say or reveal his name. Instead, we're calling him AT as his nickname for this interview.
Good afternoon to 80. Today we have brought you here to tell us your experience of how you become a victim of HIV.
Well, yeah, of course. So it started in my high school days. I got into an accident and I was rushed to the hospital. I lost all my blood from the accident and need blood donor. My father volunteered to be my blood donor since we have the same blood type. They hooked us into a machine that sucks out blood from my father and inject it to me. After that, they treated my wound and rested in the hospital for a week. After a month that I got out of the hospital, I started to notice that I was frequently getting sick and having headaches. My family were noticing it too. They told me to go and get myself checked up by the doctor. The doctor asked for my symptoms and what I've been doing before I got my symptoms. I told them everything and the doctor might suspect that I have AIDS, HIV transferred into me from that blood transfusion. They got me tested for HIV and I was positive. The doctor prescribed me some medicine to get me mitigate my HIV.
Thank you, 80, for sharing your experience on HIV. We're glad to interview you.
And now you know the basic information about HIV. We're gonna head on over to our main topic, the Republic Act 8504.
In the Philippines, the fight against HIV or AIDS epidemic has faced numerous challenges. However, in 1998, a crucial piece of legislation emerged, Republic Act 8504. This act not only marked a turning point in public health policy, but also aimed to empower individuals and communities affected by the virus. This documentary delves into the historic significance and impact of Republic Act 8504. It is known as the Philippines AIDS Prevention and Control Act. Was enacted under the administration of then-President Joseph Estrada. The legislation was the result of collaborative efforts from various stakeholders, including government officials, health advocates from non-governmental organizations or NGOs, and community groups and healthcare professionals who recognize the urgent need for a structured response to the rising rates of HIV or AIDS. With this, we interview one of the member of government officials that were responsible for this act.
Good afternoon, Miss.
Good afternoon, my name is Abelia.
Isabella, could you tell us what is RA 8504 and why it was declared?
RA 8504, also known as the Philippine AIDS Prevention and Control Act of 1998, was enacted to address the growing concern over HIV or AIDS in the Philippines. It aims to create a comprehensive national program for the prevention and control of HIV or AIDS, promotes awareness, and provides support for those affected by the disease. The law was declared in response to the increasing incidence of HIV or AIDS and the need for a coordinated approach to manage its impact on public health. It emphasizes education prevention strategies and the protection of the rights of individuals with HIV or AIDS, aiming to reduce stigma and discrimination while ensuring access to treatment and care.
Thank you, Miss Isabella, for sharing us this information about RA 8504.
1990s saw a worrying trend in the Philippines, the rising number of HIV/AIDS cases. According to the Department of Health, the need for a comprehensive response became evident as thousands were affected, facing stigma, discrimination, and adequate healthcare access. Reports indicated that the number of reported access had risen significantly, highlighting a public health crisis, while activities argued that those affected needed protection against discrimination and access to healthcare. It established a framework for the prevention and control of HIV/AIDS in the Philippines, with key provisions that include comprehensive health program, confidentiality protection, public awareness campaign, and inter-agency coordination. The act has significantly impacted public health policy in the lives of many Filipinos by increasing access to services, empowering individuals, and gaining international recognition for the Philippines' proactive approach to managing the HIV/AIDS crisis. Implementation of Public Act 8504 was met with both success and challenges. While the government initiatives launched various programs, including free testing and counseling services, community involvement played a vital role in the grassroots outreach, education, and support services. However, challenges such as funding limitation and persistent cultural stigma hindered outreach effort. While Republic Act 8504 laid a strong foundation, the fight against HIV/AIDS is far from over. Continued advocacy, funding, and community engagement are essential to ensure that the rights and health of all Filipinos are protected. Together, we can build a healthier future for all. The legacy of Republic Act 8504 lives on, serving as a testament to the power of unity and action in the face of adversity. AIDS is also called it's caused the human immunodeficiency virus.
After a month that I got out of the... Wait lang, ingay na.
Kulang muna namin.
Diyan ka muna ha.
Maya tayo, kita tayo. Bukas.
Game na.
Kulang muna namin.
Ito ako sa job.
Hindi, okay na ba yan?
Game na. Game na.
Thank you, 80, for sharing your experience on HIV. Game, mag-ingay kayo! Camera action!
AIDS is an ongoing, also called chronic. You know, victim from HIV.
Hindi, yung ano. We have brought you here to the tangin na nipa.
3, 2, 1,
Camera action! 2, 1. Good afternoon to 80. Today we have brought you... Ay, brought... Thank you, 80, for your sharing your experience. Ulit.
Wait lang, test.
One.
Go.
And now, you know, ano yan? Thank you, 80, for...
Usag mo konti rito, usag mo. Dito konti. Dito mo yung... Dito mo yung script.
Dito.